How many people here are NRA members? I'm just curious. I'm just curious. Yeah. Just wondering. Okay. Talking about dentistry, I was so happy this morning. I told my wife, you know, that claim jumper is really a cool place. They have an overhead projector. They have a screen on the wall. All I have to bring today is my laptop, and I can give the presentation. So I cruise up to the claim jumper this morning. No cars, emails? Nobody in the window. I go. It was 3 weeks, but one of the weeks, the first 3 weeks, I was out of town. Yeah. And that's what. Anyway, so I have a presentation on my laptop, which we can do some other time, but it's everything's okay, because I was thinking, well, maybe you all are tired of seeing teeth and all, because I think some people were grossed out by the pictures, which I've been a dentist. This is my 47th year, so this is, to me, it's just work, and which I enjoy. I'm very fortunate. I enjoy my work, and I'm good at it. And at this point in my dental career, I'm highly respected by the dental community. So I gave a lecture Monday to two periodontists, two gum specialists, who wanted help with how to adjust bites. Because if the bite is crooked and a patient has gum problems, it's not going to go away no matter how much you clean the root. So, and one of the periodontists told me, I like sending you patients for restorative because you're in the top 2% of dentists that I know. So that was quite a compliment, and I really liked hearing it from a specialist, someone that knows a lot of dentists. So one of the things this morning when I thought, well, I can't show pictures, but I should talk about some things that are of interest to all of you. How many people here use a water pick? Okay, all right. Well, the water pick was very popular when it first came out. And I got one, I used it, because I get everything for free. They give it to me. No, they give it to me. He says, here, use this, promote it for your patients. And I used it, and I thought, well, it's good. I like it. But in quite a few years, I've had patients come in with difficult to diagnose pain. And then I narrowed it down to they're shooting the water pick up into the gums, which is not what they're designed for. They have a very strong jet of air. If you do it between your teeth, you know, at a right angle to the long axis of your teeth, it works just fine and nothing wrong with it. But you must keep it on low, the low volume, and never shoot it into your gums, always across the teeth. Then it is effective. But some people have problems with dexterity, and not a joke. Some people have difficulty with dexterity, and elderly people, if, you know, when their hands are sometimes they're losing dexterity, it's kind of dangerous. So I have hygienists that say they like it, and I said, I think it's good also, but just be very careful with it. Some of the new items we have now, I've spoken of zirconia. Guy knows zirconia is what they use to make artificial diamonds, right? Mm-hmm. So it's very hard, very strong. And they can also make knives out of it, the Yoshi blade, that's zirconia, and make crowns out of it, teeth out of it. And lately they've been able to color it to make it look like teeth. So it's actually very attractive, and not quite as attractive as the most aesthetic, which is Emax. But we'll talk about that in a minute. But the zirconia is stronger than steel. I haven't seen one break yet, I've been doing them for about 4 years now and keeping track, haven't had them break. And the big thing I hated about the porcelain crowns, you know, how many people here have porcelain crowns in their mouth? The big thing about porcelain is it chips. And unfortunately, it's hard to fix, and you can't usually fix it. You can try to bond something on, but the bond breaks. But that was the industry standard for probably 4 or 5 decades. That's 40, 50 years. Porcelain fused to metal. The negative of porcelain fused to metal is it's not as smooth as your natural teeth. So if you put your tongue on the porcelain crown, it feels smooth, but not as smooth as your natural teeth. And the negative is it wears the opposing tooth. So if you have a porcelain crown chewing on a natural tooth or on a gold crown, it wears them down. And the other item about porcelain is when you bite, it hits pretty hard, which is a negative about zirconia. Zirconia is so hard when you bite, there's no give. So you have to be very careful with the bite adjustment, make sure the patient is comfortable. But the good thing about zirconia, it's much more polishable. You can polish zirconia so it's so smooth it doesn't wear the opposing teeth. So it's better than porcelain on a lot of counts, and that's good. And the next new item is Emax. The scientific name is lithium disilicate. It's very, very, I don't know who thinks of these things, but they're a godsend to dentistry. Some of my patients here that have had porcelain versus Emax, we look at them, show them the teeth, and Emax looks much better. But besides looking better, it's harder than porcelain, stronger than porcelain. Not as strong as zirconia, but strong enough for me to put them on all the front teeth that I do now because they don't chip. And that's one thing I hated through my whole dental career. We're talking 40, almost 50 years. Put a beautiful crown, a beautiful bridge, get multiple teeth, show the patient they love it. You know, then they bite a fork or they eat a rock and they chip something, and it's not as good as it used to be. So Emax is much stronger, and zirconia is strongest. And for people that are hard biters, I have some patients that break a lot of things I put in their mouth. They don't break zirconia, so we put in zirconia. But I mean, it's so strong that if you bite really hard, the root will fracture, but the zirconia won't. So, you know, there's no perfect way. So, but now they're using zirconia for frames to make an entire arch. For people that used to have a denture, they have implants, they put zirconia frames on there to make dentures, and they come out nice. It's a whole new world that you just have to keep listening to, embracing, and I've been tracking them for years. When they come out, I watch how they do it. And the crowns that are done with zirconia and Emax are done on a computer, actually. And the computer software determines the shape of the tooth, but also, and I don't know how they do it, somebody really smart is in there, but they take a picture of the opposing tooth and they can get the same shape of the tooth, but then tweak the bite so that when the patient comes in and bites on it, the bite is correct. And that's been about 5 years. Lately, they've been doing better. The first crowns that were done on a computer were very poor. They didn't fit that well, and I didn't use them because they didn't fit that well. Now they fit well, but then the next step was the bite was difficult to adjust. So the latest software, they're about as good as a crown done by a highly competent technician. So these are all the things that I evaluate and do and study. And of course with the TMJ, I go to conventions. This year I went to the American Equilibration Society, and that's about every year, about 300 dentists worldwide that come to Chicago and meet and talk about bite problems and jaw problems. And they asked me this year, gee, you didn't bring a case. We thought you were going to bring a case. I said, I didn't have something revolutionary or different or something, so I just passed. I didn't want to do something that was redundant. So I said, but next year I'll have a good one, which I do. And so anyway, I have a good reputation amongst the dentists that treat TMJ. And they asked me, she said, you got to do one next year. I said, I will. And they also asked me to do a lecture in 2019. That's how far in advance they planned. When we showed up this year in February, we already had a page for the total program for 2017. So when the head man asked me, oh, do you want to give a lecture? And I said, sure. So I just assumed it was 2018. He says, no, 2019, we're really planning. So I said, hey, all right, fine. It gives me time to prepare.
Exactly.
But anyone here have arthritis? Anybody here have arthritis? Okay. Anybody here have rheumatoid arthritis? Rheumatoid arthritis is the worst kind. That really eats up your bones. And I had a patient that I did, and this is what I'm going to talk about next year. I have a patient that came to me 7 years ago, and she had rheumatoid arthritis, pain, and very attractive gal in her 40s, and nice clothes. And I knew her background. She came from a tough neighborhood, and she just did well. Married a hardworking guy that had a great life. I could tell by her hair, her nails, her clothing, everything was just right. And then we take x-rays and we show she has arthritis. I mean, bad rheumatoid arthritis, which was already diagnosed, but it went to her jaw joint. And her bones looked like moth-eaten. So I fixed her bite as best I could. She said she was comfortable, no more pain in the joints. And I made her a device to wear to protect her teeth at night. See, so many dentists said, I'm going to treat your jaw problem. They right away give a patient something to wear. But even if it works, which it doesn't most of the time, even if it works, when you take out the device, if the bite is still crooked, the jaw is still displacing. There's harm being done. So you have to correct the bite, make sure the bite is perfect, comfortable, not moving the condyles abnormally. Then you make them a device to wear at night to keep them from wearing down. So that's what I did 7 years ago. And then she came from Pasadena. Well, she moved to Irvine and said, I want you to do my dentistry because you did such a good job with my bite. I've had no problems in 7 years. I said, well, let's x-ray your bone, see how you're doing. She says, I don't need that, I have no pain. So I paid the $200 for the x-rays and the cone beams and this cone beam CT scans. And the bone has actually healed in a few areas. It was not nearly as bad as it used to be, whereas she's told me she expected to see powder in her joints. That's why she didn't want to take the picture. She didn't want to see that it got uglier. But it didn't, it got better. So this is very revolutionary. And I'm writing a blurb for Sean. I haven't sent it yet, but I already worked on it. And we're going to put it on the website, that rheumatoid arthritis is not the end of the world for your jaw joints. So that's going to be revolutionary. So how am I doing for time? Are we okay?
You're doing great.
What's that? How much time we have?
We have a minute and a half.
Oh, sound like my wife, yes. A joke, just a joke. It's a joke. That's another true story. It's another true story. I'm giving I have the line ready. See, that's the thing. The line's all ready. I don't have to think of it. The line's ready. I'm giving a lecture at UNLV, and the professor, the big shot at the school, says, you have 5 minutes. And I'm telling jokes. He's not laughing. He says, you have 5 minutes. And I said, 5 minutes. That's what my wife said to me the other night. And the girl in the front row laughed so hard she almost fell out of her chair. So, but the lines are ready, see, so it's fun. It's fun. Okay, so the clean joke of the week. Good. The clean joke of the week is Bernie Sanders in a tuxedo. Bernie Sanders in a tuxedo with a Dos Equis in the foreground. And the caption says, "I don't often drink beer, but when I do, it's other people's." So, any questions about dentistry? I'm sorry I don't have the picture, but
I do actually.
I don't have anything to discuss.
Dr. Mark, I do have a question. I'd like your opinion on the sonic toothbrushes, the vibrating. The
I have 2 of them.
You do?
I have 2 of them, and I recommend it to all my patients. That's a good one. It's a good answer, huh?
Yeah, it is.
Oh, the other thing I always mention, but it's going up. I have over 4,000 hours of continuing ed, and the requirement for continuing ed for dentists is 50 hours every 2 years. So that's 25 hours of continuing ed courses per year, or 50 in 1 year, doesn't matter. And I usually average about 200 a year. So I quadruple the state requirement. And every time I give a lecture, I get time and a half. Like I talked to the periodontist for 3 hours. I got 4.5 hours credit because I taught the course. So I'm deeply involved in dentistry. I love it, highly committed. Committed till 2019 for sure.